welcome everyone. So Shubham is going to be my backup. So just to introduce, he's my co-founder partner as well. So we'll get started with today's discussion. And so what I'm going to do is basically we are going to have a freewheeling conversation about how and what the future of digital adoption looks like in specifically in healthcare as a sector. Before we start, the webinar is being recorded and it is being kind of uploaded to the Zoom cloud as we speak. That I'm going to set the context, the agenda. There is going to be a deck that is going to run in parallel, but it just has a high level pointers which we can just refer and talk about what are your experiences, what are your insights, and so on. So given that as a context, let me introduce the panelists first. So meet Ekta. She is a global CHRO at AGS Health. Ekta, if you could introduce yourself in like 30-40 seconds, I will then pass on to Harry.
Absolutely. That's interesting. 25 plus years in 30 seconds. That's a challenge. All right. So good morning, good evening, everybody. I'm Ekta Singh. As Prasanna mentioned, I'm CHRO at AGS Health. And I've been here for a year and a half. I come from the technology background. So this is my first stint into healthcare. So don't judge me. Prior to working at AGS, I was with Capgemini, and prior to that with Deloitte, Royal Bank of Scotland, and before that in US with a company called Corpus Incorporate, which was a startup, again in the tech space. So that's my career journey. Always been in HR, always loved, resolving challenges is how I put it. And every day is a surprise. And that's what I like about being in HR. Thank you.
Thank you so much, Ekta. I'm sorry, it was not meant to be 30 seconds, but you made it. So Harry, our other panelist is Harry. He has a wide experience in healthcare as a sector, and he's a digital health and transformation advisor. And he has been on supervisory boards on multiple agencies, startups. And Harry, if you could introduce yourself like in 30 seconds again, it would be great, and we can get started from there.
Thank you very much, Prasanna. So my name is Harry Meijer. All my life, I've been working on digital health and transformation, and on transformation of large companies, and help also startups. Over the last 2 years, I've been working for WHO, and I helped to write the global strategy on digital health. Previously, I have been working for companies like Accenture and Cyber, all continents, many customers in healthcare and financial services industry. Today, and the last 10 years, my focus is really on patient-centric healthcare, consumer-centric care, and to find the right balance between technology, people, governance, in the support for health workers. Back to you.
Thank you, Harry. I will quickly introduce myself. I'm Prasanna, one of the co-founders, CEO, co-founder of Guide. We are a digital adoption platform, and we are based out in Pune, India. Harry is based out in Germany, if I'm not wrong, Harry. And Ekta is from India, but she's currently joining us from Washington, DC, USA. So first of all, thank you, Harry, and thank you, Ekta, for making time for this and talking about the adoption, the digital transformation in healthcare. Really appreciate spending your time with us. We'll get started right away. So I will move the slides. So I will just set the agenda, what we are going to cover in like 35 to 40 minutes of discussion, and then 10-15 minutes of questions and answers. And we'll kind of top it that with the Q&A, and then we'll conclude by the top of the hour. That's going to be the plan. So we'll cover how the digital transformation wave is happening in healthcare. So Ekta and Harry, I will pass on the questions to you. If you find any question which is maybe you would like to answer or you would not like to answer, just say it out loud. It's a completely informal way, so just say it out loud and I will move on. Digital transformation wave, challenges faced by healthcare industry, challenges related to specifically change management, user training, digital adoption. What does lack of adoption mean for the ROIs of technology or any other investments that are being happening in healthcare as a sector? Techniques to address these things currently, how platforms, the digital adoption platforms can help. And then we have a small case study which we would like to present, which is like we are working with a company called South County Health. We'll show how and what we are doing with them. So I will go first. So Ekta, digital transformation wave in healthcare industry. So past 10 years and then 2 years of COVID, everyone knows what has happened. So what are your takes on that? And then we'll move to Harry.
Absolutely. Thank you, Prasanna. So you're absolutely right. 10 years, I don't know how much transformation happened in this space. I'm confident my co-panelist Harry will share that. But what I can tell you is in the last 2 years, the world definitely has changed. I mean, you and I today, we are having this conversation via Zoom. I'm confident 2 years ago, we would have insisted to be in the same place, in the same location, right? Now, in healthcare, just to give you an example, and this is across the world, it's not just limited to US or India or Germany, the 3 countries that we are currently based out of. The first transformation has been a video consultation itself. I mean, could you have ever imagined that we will consult via video for many types of ailments? I mean, we would refuse to go into the hospital, right? That itself, in my view, is a huge transformation. But from my point of view, I think it is the entire patient experience that really needs to be talked about. And I'll be happy to share what we in AGS are doing. But from my point of view, I think right from where a patient makes an appointment to scheduling, to test and predictive, what can go wrong, what cannot go wrong. In that space, we've done quite a bit of work, quite a lot of analytics around that as well. And I'll again be sharing as we discuss more today. But I think it's been not just night and day, but I think it's been night of a different month and day of another month is how I would probably put it. Or maybe even in a year, 19 to 20. Massive change from that point of view, where you have your phones that actually will remind you once you've made an appointment saying, hey, do you have an appointment? Do you want to go? Number one. Number two, it gives you an option of, do you want to book a cab? Here is Uber, here are other, apps that are available to make the appointment. And after the appointment is over, then it kind of gives you reminders of how was your experience? Do you want to rate us? Do you want to write a review? So the world has just been changing dramatically in the healthcare sector, and technology is definitely a partner to stay. That's how I put it.
Sure. Sounds really encouraging, interesting for all of us. So Harry, we talked briefly about how the healthcare providers, the hospitals are still the way they are in 1800s maybe. But what are your thoughts on the digital aspects of them being improving or not improving, or what have been your experiences?
Digital transformation, I think, is foundational to turn around health systems and to help healthcare delivery organizations facing the challenges we are. The biggest challenge we have is the gap between demand and supply. We are more people and we grow older. And as we grow older, live longer, we have more complexity. On the other hand, we have less health workers. And COVID triggered also quite high rate of sickness absence. So we need to fill that gap, and digital transformation could help us. Following a long period of almost non-disruptive evolution, 2,500 years of non-disruptive evolution. Our hospitals look still like what the Romans built. If you look at the pictures of that Roman hospital, even the older ones from the Greece look very much the same. Today, average hospital produces 50 petabytes of data and we use only 3%. Digital transformation is so foundational. It's a 3-step process. The first step was where we went from analog to digital, and today we are in that first step to digitize an organization, and we should move to step 2 and 3, which is digitalization and the full scale up of digital transformation. Today, we have a lot of what I call islands of IT, which needs to be connected. We need to spend some time on improving the processes. We have invested since 1990 10 to 60% year on year in digital assets, but the productivity is still on the level of 1990.
Yep.
So there is a big challenge. We need to help the health workers, the hospitals, to get the work done with less resources, more work with less resources. And technology can play a very big role.
Yep. True. I mean, to say what you're saying, right? So I think you briefly touched upon the few challenges that healthcare as an industry is facing. Maybe because of the regulatory nature of the industry, or maybe because of the maybe because the conservativeness of the industry, or maybe because the digital transformation and the underlying business are not really aligned. So Harry, if you could identify specific challenges that are getting exacerbated because of rapid digital transformation, because we are rolling out new apps, because we are rolling out new systems every day, but what is happening because of that? Are there any challenges that are arising in the healthcare as an industry?
Yeah, I think the first challenge is, no, let's start different. Digital transformation is very beautiful and should help us to have more fun in work. It should help a health worker to spend more time with a patient and less on the keyboard. That's what we are looking for. This fourth in this industrial revolution is welcomed, and we see a lot of initiatives, early starting initiatives, but the big challenge is to embed it in the primary process in a hospital, to make it really part of our daily life and not just a pilot or a project. We see a lot of pilotitis, but the key thing, it's a critical success factor, is really the embedding in the primary process. That's, I think, one of the most important critical success factors, Prasanna.
Yeah. Ekta, your take on the challenges currently the healthcare industry faces?
I think from my point of view, again, I'm looking from a service provider point of lens, right? So for us, everything that Harry says, definitely archaic systems, very old. But I think what COVID kind of pushed the envelope, so to say, is the challenge of shortage of resources, number one. Number two, repetitive work. The same kind of type of work being done over and over again without any thought of automating processes or even predicting any kind of, challenges. For example, I could give you something that we are currently working at AGS, right? So we have software that can actually predict. So for example, let's say there is a 65-year-old male, with a certain economic status, working in a certain sector. And if we input the data, this machine has the capability of learning and saying, oh, by the way, these are the ailments that this individual currently has. Therefore, what's the next step that we need to be in, take in mind. And remember, in the US regulatory system for healthcare is absolutely super strong. So there are elements of pre-authorization that you need to keep in mind, right? So all of that is and predictive work. A challenge is nobody really thinks about it. For example, that 65-year-old has got a diabetes, and therefore, what are the other ailments that we need to think of? And without the patient actually coming to know, can I take a prior authorization and make the experience not just between the doctor, the nurse, and the patient, but the overall experience, I think is missing. The holisticness is definitely a challenge. Most of us are just focused on the experience at the hospital. But what about the bill that you get after? That's also another challenge, and nobody thinks about it. We don't think about the surprises that you could, go in for a checkup and you could come with a massive bill. Nobody thinks about those aspects. So I think in my view, experience, again, I'm coming from an HR and services angle, the human element of the experience is very critical, and technology has the power to change that experience completely.
Yeah, yeah, true. Yeah, as you rightly said, the holistic approach of the healthcare system is, we see it lacking almost everywhere, every part of the world, if I may presume that way. Now I'm kind of driving a little more in depth of, let's say, there is this digital transformation, or there is all these systems, and as Harry was mentioning, we have created these islands of IT systems, we have created. What it means for, let's say, employee facing applications within healthcare systems or hospitals or health clinics, and for the end users and also. So what you are seeing in front of you when you talk to any healthcare provider, what they talk about change management or training of these users, whether patients or within their own companies or organization users. Ekta, do you want to go first?
Sure, I can try to take a stab at it. I think the challenge there in this heavy loaded question you're asking, Prasanna, is you're expecting someone to use a technology that's built today that has never even used a smartphone before. That's the challenge we're talking about. So absolutely, there is a huge change management there, right from explaining what is the benefit of not being able to talk to a human being, but actually a system, a machine, or an app doing all of that for you. What's the benefit from a time point of view, from an experience point of view, from a technology point of view? I think all of that is what we need to think about from a change management. But from an employee, let's say from our lens, right, at AGS, we have, like I was talking about, we've built what we call the next best option, right? So for the next best action, rather, the predictive and the artificial intelligence that kind of goes in is able to anticipate and therefore give the employee the chance of saying, you don't have to code 10 charts. Here is one simple way of, making that chart. So from that point of view, it's a huge adoption that needs to happen. Change both from an employee point of view of, hey, I do not have to enter, but the system can do it for me. And all I have to do is validate and verify. That's the change. And from an user point of view, as I was mentioning, you are expecting different generations to be using the same system. Am I really used to it? I don't know. Maybe I'm comfortable, but maybe there is someone out there that doesn't know. Like my 9-year-old is very comfortable using any app she can figure out in 30 seconds. And she can tell me, hey, you don't know these features are there. But for me, it would probably, take perhaps 10, 15 minutes to figure out, yes, other features there. So you're talking generations using, but the same one. You're not being intuitive. And in healthcare, Harry rightly said, these are really old systems which we want to carry out the legacy because we just are very worried about what the change can bring. Well, the change brought COVID and we survived. So I guess we have to keep that in mind and move forward.
Harry, your take on this whole entire change management and user training for employees as well as patients, end users of the healthcare systems. Your take on that?
Yeah, thank you, Prasanna. This is again, this is very important, and it starts already before we look at the slide. We need to involve the users and the employees whilst we are starting to develop the applications. We really need to start it the development operation mode where they are early involved. That's the first thing. And the second is we need to be very clear on what is the value for the different stakeholders. We need to articulate it. We need to articulate this value by group of stakeholders. So for the employee and for the users. That gives a different starting position when you do this training in digital adoption. Then you have much more involved users and employees. And digital literacy and equity, you already talked about it, Ekta. It plays an important role. In the outcomes, what are the potential outcomes of all these applications? We need to sense these outcomes and to taste the outcomes. Helps us in also understanding what is the incremental benefit. Back to you, Prasanna.
So just delving a little more on this, Harry. Do you see organizations spending a lot of time in conducting these change management programs, user training programs, or has this changed in last 3-4 years to something more efficient, something more modern, I would say?
We need to mature this. This is the short answer. It needs much more effort to make it a success. Then we have invested in digital assets, but we need to capitalize on it. We need to train the people. Interesting is this whole capacity strengthening model with the United Nations, WHO, the leading universities teach in the public health, talks about this capacity model, which was developed on the basis of the learning from some pilots in India in the 90s. Now, one of the key insights was you can't limit it just to technology. Don't take a siloed approach. You need to look at all the components of capacity building. That makes a success. And training in digital adoption is one of the critical success factors. And you see it today. India made great progress, for example, on digital transformation and also on the access to healthcare. 3-4 years ago, 80% had no access, 30%. It's now reduced last year to 30%. It's an enormous progress India made. So this is one of the most important tools to capitalize on the big digital assets investments we make on investments we made on digital assets over the last 30 years.
Sure. Ekta, have you seen any change management programs being run by any of your, either internally at your place or any of your customers' place? How those programs pan out in today's world?
So the answer is yes, absolutely. Both at our quite a few of our clients and internally, of course, we constantly in the process of not just change management. I have 3 aspects. Let me bring it that way, right? So you have to upskill your employees or cross-skill them, right? Yep. Depending on where they are. But more importantly, I think the value prop has to be told. Yeah. We make many a times as an organization, there are assumptions that are made that each one of us is comfortable with the change because it's for the good, right? But not everybody is open to the idea. Therefore, explaining why you need to change is very, very important. Number one. Number two, then investing in. So internally, Prasanna, at AGS, we've invested very heavily in training. In fact, we've received an award externally as well from, TIS and Leap Vault, which primarily gives out annual awards for the best training, domain training that AGS Health has done. So absolutely, the answer is yes. Internally, we're doing a lot. At a client side also, many of our clients actually have asked us to come and help them do the change management, because we are, of course, building not just the technology, but also the predictive analytics that go behind it, right? So even for our clients, we've partnered and come up with quite a lot of change management programs, which are not limited. I don't want to use the word training because it's an experience that we are offering.
Yeah.
That's how I'd put it.
Yeah. Yeah. Okay, so let's move on a little. So Harry, I would like to ask you this question first, and then I will go to Ekta. So because when I talked to you before, you have been mentioning about these islands of IT systems, right? So and this kind of question takes back to that particular scenario where you have tons and tons of apps being rolled out, either internally, externally, for your vendors, contractors, health workers, everything. And when those apps or when those systems, they don't get adopted, how the impact is there on the ROI and on the overall business as such?
Yeah, we absolutely need these integration capabilities and to expand on the interoperability. It are often in many countries, many organizations, different level, I see these islands of IT. And I see health workers really struggling with it. An healthcare delivery organization invested massively in a third generation electronic healthcare record, but the health worker still needs to print a document from another system and then again enter all the data in this system. If you spend 30–40% of your time on administrative tasks on the keyboard, it's not contributing to the overall ROI. And we need to look at it needs to be a patient-centric point of view. You talked about the holistic. Holistic is important. To today's world, we talk about patient centricity. So the patient is the point of orientation in the process. That's how we need to look at it. So we need to connect all the silos. We need to bridge these islands, and that will have a big impact then on the return on investment.
Yeah, yeah. So have you been able to quantify this impact, Harry, at either at one place or let's say on an aggregate level? Do you think that let's say there are 70 systems that have been built at in an organization? So I read a survey somewhere that average organization is using more than 100 systems or 100 apps these days. So even if we consider 70 or 100 systems being built, I mean, how do we quantify this lack of ROI or lack of or the impact on ROI? Because people are not been able to use the systems because they are not integrated, because they don't know how to use the systems, and so on and so forth.
Yeah, I was able to a business case and to implement a more integrated approach, including better care pathways. Mm-hmm. And the answer was that these healthcare delivery organizations were able to free up 40% of capacity. So you could do more work, 40% more work with the current workforce, and they were able to have a much better return, to have a much better return on investment on their digital assets.
Sure, sure.
So
Ekta,
it was a very convincing business case.
okay, okay. So this was like done on a large scale that where you can see the actual benefits being translated.
Yes.
Yeah,
Yes,
yeah.
it was across some hospitals and healthcare delivery institutes, elderly homes. So it's not limited to one type of healthcare delivery organizations, but across some healthcare delivery organizations in 3-4 countries.
Got it. Got it. Ekta, do you see these silos of the systems being the one of the challenges or one of the bottlenecks that needs to get solved before the real ROI is seen for the businesses, for your company? How do you see this?
Absolutely. I think, one of the many reasons why organizations like ours are evolving continuously is because there is an ROI available. Harry is absolutely right that there is a huge business opportunity out there for us to experience. And what the last 2 years, I'm confident there's, even our listeners who are dialed in today, if any of them have experienced, for example, either they loved one or a family member or a friend getting hospitalized in the last 2 years, the doctors usually will come in the morning to make a round and then decide what the treatment is and then the discharge opportunity. But I'm confident most of you will also tell me that the experience of that whole discharge process takes forever. That's a classic example of disjointed systems, right? Because there is some human being that's sitting and typing 5 days worth of data, which will naturally take 2-3 hours till you submit it to the third party that submits it to the insurance provider, and then again that process back. And if there is a query, then imagine that going back and forth. So 10 in the morning, 11 in the morning, and you've not discharged the patient till 7 or 8 in the evening. You've lost an entire bed, therefore, right, for that day. Now, that's a huge opportunity and money lost. But I think it's larger than that. It's the vision that we have to look at. Harry did mention about the study that was done in India about the doctors and the nurses, etc., and how we operate. All of that has to be rethought. The nurses are stretched. They are, doing the same job, the administrative job and, data entry job, which should not be part of what they need to do. They should be caregivers. And hence, is there a lack? Absolutely. Is there a need? I would probably say, hell yes.
Okay, okay, yeah, yeah. I think at least from the Indian context, the patient getting discharged, I can vouch or I can agree 100% with Ekta that it literally takes a day from morning to evening just to complete the all formalities if you are admitted to the hospital and getting discharged. So it's really bad experience from the patient standpoint that way.
Yeah, totally. Totally.
Yeah. I've just listed few current techniques that are being taken to address these challenges. So be it the instructor-led trainings, be it creating these user manuals, be it the IT support, the customer support, the patient support. I mean, so Ekta, I will go to first you and then to Harry. Do you see these things evolving, improving, and how do you see these things? Let's say in 2025, or how should we go about addressing the challenge of adoption using the current techniques, or do you see anything better, efficient than this being already happening at your place or your client's place?
Absolutely. So, Prasanna, it's a very good question and one that's music to an HR's ears, right? Because for me, this makes the future of the organization that much better. So today, if you look at it, even in India, the education system is changing, right? We are introducing the vocational training program that will get introduced right at high school level itself. So in not just the right of education, which was taking the children till the high school, but now a vocational training. And technology is a massive requirement in that, no matter what kind of vocational training the students pick. For us at AGS, what we've done is we've actually gone ahead and made relationship with colleges, universities to actually teach our context, curriculum, healthcare, revenue cycle, technology, analytics, while they're still in their college.
Wow.
Therefore, when they graduate, for us, that much is the less training time because we can take, select these students and bring them on board with a very small training time instead of the long 3 months or whatever that historically used to be. So that definitely has changed. Now it also gives exposure internally for our own leaders who have to go and facilitate those programs, because then they're getting the exposure of going back to a campus and actually saying, by the way, this is how the industry works. So that experience sharing is absolutely remarkable. Last but not the least, case studies are being given. So there's a competition that is, gets created, and the environment is of hunger to learn.
Yeah.
So from my point of view, massive changes are happening. It is an ever evolving challenge. Today, I'm sharing it on this platform. I'm confident there'll be 4 or 5 organizations out there that will say, wow, that was a good idea. Prasanna also raised his eyebrows to, when Ekta was sharing. So chances are 4 other organizations will contact those universities and say, by the way, we would like to create something similar. And hence the employability that we're talking about just increases in multi-fold. So that's how I kind of look at it.
Sure, sure. Yeah, I mean, yeah, that's a really good way to kind of pre-do lot of things before someone comes on board or someone gets into the real world or ready for the job. Harry,
Absolutely.
how you look at these things? I mean, do you see a lot of time still being spent on the trainings, creating 100-page user manuals, support, and so on? What are your observations recently?
Yeah, let me start with user-facing applications. So we are, and you mentioned earlier 2025. I think it's so important if we develop a roadmap uh, to look also at the end game. And the end game is almost happening today. The patient becomes the CEO of the patient journey. We are developing many more digital channels communicating with patients, and the patients also collecting data and sharing it with healthcare providers. It's not only clinical data which are now collected, the patient also collects data like patient registered outcomes, a sensor on the arm to collect data on the diabetes, measuring the blood pressure, etc. Today we are sharing a lot. Patients share a lot of data, which they are already sharing with their healthcare workers. So we need to help the users, the patients, the healthcare consumers, to work in the most efficient and easy way, user-friendly way with these new channels. That's, I think, key. Whilst we are moving to this horizon 2025, as you mentioned. And we need to step up also at the training of the employees who face more and more applications. Almost every day, one more. We need to really support here the health workers.
Got it. Got it. Okay, so this slide, I'm going to take a little bit of time on this slide. So, there is something called as digital adoption platform. So, using these platforms, not all of what Ekta and Harry were talking about can be solved, but at least the system trainings, the application trainings can be really effectively solved if we employ or if we make use of something like DAP or digital adoption platform. So it comes with its own features, like there are these step-by-step guides, step-by-step walkthroughs, then contextual help articles, which is like uh, you can explain the basically learn while work, right? So they don't have to go out to learn a simple system or a comprehensive system which is being thrown to them, as Harry mentioned one new today. So they don't have to go out of the system. The lot of training sessions are not needed. I think the dApps or digital adoption platforms will kind of fits into this transformation as a journey where which healthcare is going through or any industry is going through for that matter. And what they really do is they kind of sit right within these applications and help users to perform their tasks efficiently, effectively. So let's say there is a task which user needs to perform once in 3 months. No one is going to remember that, giving the attention span going down every day. So no one is going to remember how to do that. But these dApps will kind of help these people, help these users, either patients or either employees or either vendors, contractors, anyone, healthcare workers, to use those systems very effectively in a way. That being said, I will kind of move on to one thing that we have been doing for one of our customers. The customer, so this is a customer called South County Health. We have been working with them for quite some time now, and how we are helping them to better use the underlying digital assets. So basically, we have integrated our platform with their one of the systems to start with, called HRMS, HR management tool. And because see, at the end of the day, not all are tech users, right? So they don't know how to create the objectives in HR systems, or how do I schedule a meeting with my manager. So all those things are right within the application. They are being able to learn and make it available. They are seeing a good return on their investment, at least up to more than 50% of the processes are getting completed faster. So the delta is really good when we are actually delivering the content when they are needing the content, right? So they don't have to go out of the system, go up, look up user manuals, go to SharePoint. So that all adds to the implementation of the system, and then it sits within the system to help you actually use that system in a better way. So that's what we have been doing for one of our customers. So these were the two slides that I wanted to kind of take most of the time on. And these are the results that you can see when you implement any tap inside your organization, for your customers, for your employees or patients or anything like that. So I think we have some chat. Uh, I think Harry and Ekta, do you have any final comments before we go for the questions and answers? It's we are almost 45 minutes in, and I know Ekta, you have a hard stop at 10:30 EST.
No, I don't have any comments. I think I'm just looking forward to the questions that our listeners may have.
Sure. Harry, any final comments before we move to Q&A?
No, I'm very much interested in the insight, the experience of the attendees.
Okay. Sounds good. So let's just see if we have any questions. Okay, I think this question is, I'll just answer because this seems to be from the DAP as a domain. Do we need DAP if we already have LMS? Okay. So LMS and DAPs are different in a way. How they are different is LMS has courses. They can have courses about anything. So LMS is like learning management system wherein you can have courses on technologies that your organization is using or your any other healthcare related compliances that you have to solve. DAP is more about understanding and helping users to use the systems, digital assets, be it mobile applications, be it cloud-based systems, be it web-based systems to use this. So LMS, even if you have LMS, yes, you really need that in a way. I will go for another question. Can non-technical staff in hospitals be trained to use mobile apps with the help of DAP? So yes, they can be. Basically, the DApps kind of integrate with the systems as we have. So be it any system, DApps can be useful for that. Be it mobile apps, be it web apps, anything right within the application, help is provided using the DApps as a concept, digital adoption platform as a concept. So yes, it can be helpful. William is asking how effective is digital adoption platform in remote training. Oh, that's really an interesting question because see, all of these last 3-4 years we have been focusing or answering questions to us that okay, is the remote going to be the future? Is remote here to stay, and so on and so forth. When you don't have colleagues, when you don't have in-office environment, then DApps are actually useful a lot because you cannot just Skype or you cannot just ask someone on Teams that, okay, how do I do this? How do I do that? It's better to kind of have the systems in place that are there. I think Rekha is asking, hi Harry, thanks for the insight. However, in your opinion, what is one framework which you would suggest for digital adoption by underprivileged countries? Harry, do you want to take this?
That's that's one of the things which keeps me very busy every day. I think low and middle income countries, digital health and digital transformation is very, very important. Then we are able to invest in a different way without creating a hockey stick business curve. We need to do it step by step. But some of the big impact we can make is with a much lower investment. If, for example, building a new hospital, it's taking that holistic approach, like you mentioned, which is key. And I have seen some examples. I have developed some frameworks with some countries. I'm happy to expand on it if you want a one-to-one chat. Please contact the organization and they will share with you my email address, and I can share with you some experiences and how to approach this.
Thank you, Harry. There is one more question from Chris, that what role does technology play in healthcare sector when it comes to managing business process? This is to you, Ekta. Should I repeat the question?
No, I think I got it. What role does technology play in healthcare sector while managing employee experience, I think is what you're talking about, correct? So I think, like I was mentioning at the beginning of our conversation, it is the care experience is how we like to define it, which is not just the front end, in terms of making appointments, scheduling, or getting the eligibility in terms of insurance, authorizations, etc. Not only that, it goes beyond the doctor, the nurse experience, and technology can play a massive role. Today, if you look at the time appointments are given, it's almost at a 5-minute intervals, right? The doctors kind of give you appointments at 5-minute intervals. And I remember as a child, we used to spend like 30 minutes with the doctor who would ask questions himself or herself, right? Today, technology can do that. There could be somebody else who may be entering all those details. And then you go to the doctor who pretty much will spend so little time with you that you, as an individual, many of them come back and say, oh my God, I don't know if the doctor even heard me. That experience, I think, is what technology can change, because you are answering the questions, you can make it interactive. And today the world is changing to that whole experience as such. And that's where the value add primarily is. And to Harry's point, the systems are not any longer in individual modes, but they're actually now connected. And if they are talking to each other, the experience flow happens, therefore. And hence, the holistic journey that I was talking about, not just the front end, but through the process, is something that technology makes a leap of change. I hope that helps.
Sure. Thank you. So I have one more question from Devendra. Challenges rapid digital transformation, infra setup, how to cope up with the technology, mindset change, culture change for the end users, typically from rural areas. Do we have any platform to address these kind of issues? So, Harry, specifically on the mindset change in the rural areas, or not so tech savvy or tech first areas, I would say. Do you have any insights? How do we do that? Any thoughts on that? It's actually a quite involved question in a way.
That's it's a big challenge. In most countries, 70% of the hospital beds and health workers are working in big cities.
Yep.
Whereas more than 50% of the population is sometimes living in rural areas. So we need to develop some smart solutions. Then over the last years, there was an approach where let's say we wanted to copy paste whatever we have as infrastructure in cities or in countries who have spent a lot of money on the infrastructure. We want to do that also in rural areas. That doesn't work. We need to do first things first. We need to make choices. That's key. So we need to make choices in the top down and bottom up approach together with the region, maybe at national level and with local level. And we need to make some choices. And that's where we need to start. I've been talking in the chat about a digital health toolkit developed when I was working for some of the organizations. That helps.
Sure.
But it looks like in general we have it's a big challenge to make choices. We want to do everything at the same time, which is not possible. We don't have the budget and not the resources.
Yeah. Ekta, do you have one more question from Jack? How do you manage to keep employees productive along with their experience in your organization?
That's also a very interesting question. How do we manage to? I think in the organization at AGS, we have a culture of learning. Now, what I mean by culture of learning, we don't mandate the hours that you have to complete as an employee. No. But what we do say is learn something new that you did not know last week or last month. That's how we kind of do it. And especially in the tech world and the analytics world that we have, we insist on continuous learning. Now, what that does is we don't invite, let me take a step back. We don't invite external people to come and train us. We don't pay money to an institute. We rather use our own employees who have learned something new and share their knowledge. What it does is not only engage the individual that's preparing the material to facilitate to their peers or their team members, but it also enhances their knowledge, because all of us know when you do research, to speak, then you naturally are going beyond what you had learned, because now you're actually converting the theory you learned into practicality, right? You're coming up with use cases, you're coming up with examples. I think that's a very interesting way for us that we have tried, tested, and it works like a charm for us at AGS. And we keep the culture going of hunger to learn. That's what we kind of, coined for.
Sure,
I
sure.
hope that helps.
Thanks, Ekta, for that. I think we'll take last question. That is for Harry. Does healthcare worker like doctors and nurses adapting to the technology, or still there is gap? I think this question is for Harry, if you want to go.
Oh, yes, absolutely. In general, yes. But you will also find a lot of no's. But in general, yes. It's key. We need to embrace it. It needs to become part of our work, of our primary process. We need to get rid of all the things we don't need to do, which belong to a secondary or tertiary process. Yes, key is to have a sound value proposition, something you feel, you experience daily basis. Like in COVID times, you had doctors, nurses walking the whole day with a diaper. There was no time to go to toilet or smoke a cigarette.
Yeah.
And some hospitals did buy baby phones, which maybe you have at home for your children. But it provided enormous value. So this is all about value. And then adopt and adapt will happen. It's the same like which app you use on your telephone for your financial services or other activities.
Okay, I think we just flew the 1 hour like we did not know how the time went by, but I know both of you have a hard stop, so I'm kind of doing this 2 minutes early, and want to thank you, Ekta and Harry, again to participate and spend an hour with us. If we have any questions from the audiences, if it's okay, I will give you their email addresses and they can reach out to you if that's okay with you. And thank you so much again.
Absolutely. It was really a good pleasure meeting you and having a conversation along with Harry and learning along the way. Thank you.
Thank you, Harry.
Thank you very much, everybody.
Yeah.
Thank you.
Bye-bye.
Bye-bye.
Bye-bye. Bye-bye.